Does everybody see it's recording on their screen?
Yes.
All right, great. Well, welcome to the 2020 Mountain State Team Roundup, co-lead roundup. We are in the last 2 weeks of our grant cycle, and we are so excited to celebrate your all's accomplishments today, and just thank you all for being awesome state teams members. And I'm going to turn it over to Joyce, who has an exciting announcement.
Yes, drum roll, da 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 da. We received our notice of award, and yay, we still exist, yeah. And it's for approved for 4 years. But as you may know or not know, we go in a non-competitive application each year for the dollars. So the continuation of the networks is approved and the money for year 1. And then we will go back in at the end of year 1 and apply for year 2. But it is 4 years. So, you know, we're excited. You take it one step at a time, and the state teams are the heart and soul of our network. You are members, you're workaholics for us. So the state teams will remain the key part of our network, and we're just excited that to have you all on our state teams. It's been a fun 3 years. I wouldn't still be doing this unless it was fun. And I can say that working with Christy and everyone has been a blessing. So anyway, enough on that. If you have any questions about our NOA.
Anybody have any questions?
What'd you say you would do?
What did we say we would do?
Yeah, well, a better way to say it.
Pardon?
That's a better way to say it than you. Good.
Well, we have it's focus around still accessibility to services, education, PCPs, telehealth, and that's the area we're most interested in seeing how that plays out, because we wrote this back in January, and that was before COVID-19 became prominent, and so we approached telemedicine as it had been. Well, as you well know, a lot's taken place over the past few months, and it's become a way of life in the medical world. So we have to go back and look at what we were going to do, said we would do, and then based on information that we get from HRSA, we'll see what we will do. But we need you, Dale. We need you.
Yeah, it's as I think you may all know, wherever you're at, the use of telemedicine is exploded. And you look at a lot of programs, they're doing in 1 month what they had projected they would do in a year with telemedicine, and some even more than that. Sometimes it's 50 times more encounters than anticipated, so for what they've done in the past. And I think what it's raising telemedicine up to a level of awareness, and now we're seeing where it can play a role. And the hope is, as often has been said, the genie's out of the bottle, but that if we do it right, that this will be sustained, that we'll continue to use telehealth, telemedicine in a way to improve access to care, because that's, in the end, that's what it's all about, is how do we improve access to services support patients and families as well as our providers. So I'm really excited about that. I'm honored that you guys have continued to include me. And you know, as you can see, I'm bullish on this whole idea. So, and by the way, just so you know, I'll just finish with that. David Flannery and I and the rest of the team have been working with the National Coordinating Center to finish up our operational procedures for telegenetics. That's real close to being completed. That'll go out for further review and hopefully publication, so we can give more guidance to people on how to appropriately use telemedicine, telegenetics.
Great. Thank you.
How would you,
Go ahead.
can I ask, Dale, is your vision to do training out to physicians and other healthcare providers on how to do telegenetics? Or?
Yeah, well, absolutely. We've learned sometimes the hard way. People get grants, they buy equipment, and it just sits there because there are a couple of reasons. People aren't trained, and it hasn't been really integrated into workflow, and so it doesn't get used. So the whole idea is that, and you'll see that in the operating procedures, that this talks about integrating into workflow, appropriate training, and continued quality improvement as we use these tools. They're just tools, and it's meant to be just part of healthcare, not something separate. And I think that's what's happening now with COVID-19, is that people are using this. Groups that, interestingly, I've been on some webinars and interviews that have been broadcast, groups that said they would never, ever use telemedicine are now adopting it. And now they're also saying, we'll never go back. It'll complement what we do in person. It doesn't replace it, it complements it. So I think we're gonna see that. But you're absolutely right. Kathy, that was your question. But that you're absolutely right. People have to be trained. They have to know how to use it appropriately and effectively, and make sure it fits into their overall routine, what we call workflow. So, and there's a lot of other issues, what we call originating sites. Where will patients go to get this service? And I think a lot more of this is going to be in the home. We're going to reach people at home, but then we have the challenge: do they have adequate connectivity to receive those services and use those tools? So there's a lot of work to be done, but I think people are seeing the value and potential benefit. So that's where we're at.
Thank you.
Awesome. Thanks for the update, Dale. All right, I think we're ready to switch gears into our gather around the fire pit, share what we've learned along the way. These are the 3 things that we had put out in the email to ask each state team if they would share with the group. And we've had a lot of requests for meetings like this, and it's actually something that we wrote into the grant application, is more collaborative meetings between the states, because it seems like something quite a few of you have told us that you like, especially when we do it in person. But in the times, we're doing the best we can right now virtually. So hopefully we'll see more of this. If you have feedback on how this call goes, please let us know if you'd like to see that going forward. But we're going to ask each team to share your greatest accomplishment. The state teams really only got started, and our first meeting, if any of you remember it, was back in January 2017. So they've been going from January 2017 till current. So we're asking for that looking back greatest accomplishment, then a lesson learned along the way, along the journey. And then now that you have all heard the great announcement and news, we're just asking for a looking ahead, or what is one change or improvement the team suggests as we look down the road onto the new horizon. So that's our looking ahead. And we thought you guys always get picked on doing alphabetical order, and Arizona always has to go first. So we have some names in a hat, or in a beaker mug here. So I'm going to just draw a name, and if we can go in this order, then that will work. And it is Texas. Melissa, are you Casey? Did Casey make it? Melissa, I saw that you were on.
And Casey will be on shortly.
Okay. You want to share, or do you want to pass until she gets on? Do you guys want to present together?
Well, it doesn't matter really. We haven't really talked a lot this week, so.
Go ahead, the stage is yours.
Okay. So looking back, Casey and I joined up to be co-leads early on, well, I guess 2018 when we were in Austin for the summit. Or no, the state team meetings. So we've been doing this for a little while. Looking back, lessons learned. You can find a lot of free resources out there. The Texas team has kind of focused on getting out there to physician's assistants and physicians, general practitioners, pediatricians, that anyone can write an order to get genetic testing. You do not have to see a geneticist. You can get the ball rolling. It's kind of equal to getting the, you break your arm, you get x-rays before you go see the orthopedist. You can have some of this stuff behind you already. At least have a general idea of what you're dealing with, and then you go to the geneticist for referrals and things like that. But who do most of us see with our kiddos or family members? We go to our general practitioner or a particular specialist. Let's see. Looking ahead, some of the things that we would like to do is create a first steps. You get that genetic diagnosis, and where do you go from there? So mainly focus, I guess, more on the families, but still continue to access those free resources. We recently got Texas Pediatric Society to add Mountain States to their resource page, their online resources for pediatricians for free. It didn't cost us a dime. We just had to make the contact and present it. So there's a lot of other associations out there that we're going to tap into. That's it for me.
Great. What did I miss your greatest accomplishment when you said we're looking back? Is it the Texas Pediatric Society? Is that one of your greatest accomplishments?
Oh yes, that I didn't put it say it as greatest accomplishments, but yes, I just said that that's what we did. We were able to get it out there, and I also learned too that anytime you want a response, you need to put response requested in the subject line. Just a side note.
Great tip.
Otherwise, people get to it when they get to it.
There you go. Awesome. All right. Thanks, Melissa. Anything else?
Not that I can think of.
Anyone have any questions for Melissa? All right. The next one, Utah. Heidi and Chuck, are you guys on?
Yes, ma'am.
There you are.
On.
Oh, no hat today, Heidi.
I couldn't find one. I guess I could have done like a baseball cap or something.
I found Joyce's in mine at the grocery store checkout line.
Yeah, I was just saying.
Go ahead.
Chuck, are you still on?
Here.
Great. So we touched base over email, and we're going to split this up. I'll let Chuck take the lead.
I forgot I was going to take the lead. Let me just find that email to remind myself.
Here, I'm gonna bump it up for you in here.
Okay, I've got it somewhere here. Yeah. So in terms of the building the strong group, we added neurology to our team. So Mike Lloyd is a pediatric neurologist who's been very involved in kids with special healthcare needs and genetic conditions, and he joined our team and brings a new, fresh perspective and energy, and is also a busy practitioner. He's based at the university, and and he connects well with the community practices. One of the things we learned was just how hard it is to change practice, and it's particularly for folks who've been, in pediatrics, you've been, the people we were working with have been in practice for quite a while, and had their ways of doing things, and to come in and say, well, you ought to try to do this, and specifically trying to implement the developmental delay algorithm, do this in a different way. Well, they were reasonably receptive, but as is probably the case for anything that we try to change, where the opportunity to change is infrequent. The way we've always done it has seemed to work. Well, it's hard to do, and I think hard to make that change, because you've got to remember it in time before you get into your old mode of doing things, and then, how was I supposed to do it differently? And then if you're busy, well, it's too easy just to fall into old patterns. But I think particularly for developmental delay, in pediatric practice, oftentimes that's something that's sort of a gradual recognition. So it's not like, some kids, okay, you get a positive screening test and now it's, oh, wow, okay, I guess we need to move. Oftentimes it's something, well, there'd been just this hint of a question before, and then maybe a hint of a question afterwards. So I think that also made it a little bit hard for some of the practitioners who were involved to really buy into it and wholeheartedly change. And then, of course, we weren't doing it as a formal study, so we didn't have rigorous data collection, reminder approaches. So I think there were a lot of things that made that a very difficult thing to implement. And if we have a chance to do it again, I think we'll do it differently. And I guess you can take, unless there's questions, Heidi, you can take over for the last part of it.
So the last thing was, looking ahead, what is one change or improvement the team suggests as we look down the road to the new horizon? And I took that as like a suggestion for Mountain States, and maybe, hopefully I took that the right way.
You can do it for Mountain States or your state team within Mountain States. And we understand when we put this out, you guys didn't know we got the continued grant funding. So it's kind of that sustainability, what's next question.
Well, one thought we had was that it feels like there's a lot of overlap between the different states and kind of what we're working on. And you all kind of are the most privy to exactly what each state is doing, as you sit in on a lot of the team meetings and stuff like that. And so we just thought that maybe if you all took the lead on kind of communicating, facilitating, and supporting collaborations between the states of projects that are really similar, that would be really probably cool and helpful, because I hear bits and pieces, but like, even if you took all our materials and you took their materials and maybe even had like a breakout on developmental delay algorithm or something, and it's really specific to that, we could really focus on what are some successes in the other states, and some suggestions and some stuff we can borrow, and maybe we have some ideas that would help someone else. And I mean, we're doing a form of that right now, so you guys are doing a great job. But if I had to pick something to say, that it would be probably down that topic. And
Heidi, would that be helpful too? Like, if we are ever allowed to meet in person again, or you mentioned breakouts, so things like that at the Genetic Summit as well?
Yeah, I think so. That would be really cool.
Okay, thanks. Got it noted. Does anybody have any questions for Heidi and Chuck? Chuck, is your greatest accomplishment the developmental delay algorithm implementation? And I know you didn't say it per se, maybe, but you went into that. So,
well, I think building the team.
Building the team. Okay, sorry. Gotcha.
I think was the accomplishment.
Gotcha.
I have a quick question. This is Melissa in Texas. We had suggested doing the maybe quarterly webinars, or not webinars, but meetings like this with the teams. Is that something you were thinking about too, or just teams that were kind of working on the same thing.
You're talking to me, sorry. I kind of like the grouping of the topics, you know, so it's really relevant and maybe extra inspiring. Oh, you're doing that. We didn't even think of doing that, you know. Not that I don't want to meet with states that are doing really different things, but grouping the states that really have a similar focus would be nice.
Oh, I agree
Well-
completely. We were thinking just a quick run through of what everybody's doing so that we can say, oh yeah, we could do that, you know, or if it's something we've done, we can make suggestions.
Yeah, this is Kathy. I was thinking about, Melissa, when you reported in Texas about getting out to your physicians, assistants, and everything. I'd like to learn more about that, and in a breakout session, I think that would be great to see what your process was and, you know, how you measured success, because I think that would be a neat thing for us to do also, yeah.
You're on mute. You're on mute, Melissa.
Thank you. Yes, that would be a good thing to collaborate on. We have definitely had some stumbling along the way, and I think we've kind of got it figured out now, or at least we're on the right track. So yeah, be happy to share.
Great. Thank you, Utah, for presenting your accomplishments, lessons learned, and looking ahead. I've picked our next team, and it is Montana. Jen, are you on? And Rachel, I don't know if Rachel is able to make it today.
Nope, I'm here. This is Jen, but Rachel's not on today.
Okay.
So the looking back is interesting for me because I've only been on the team, I think, for the last year of the grant. So I wasn't there for the beginning. And so in terms of looking back in the time that I've been a co-lead, I think I don't know, there's a lot of things that's hard to choose, because I know one of the things is I think that our relationship with the genetics hospital and our genetic testing center, in terms of seeing it from the family perspective and stuff, I think that relationship was really strengthened by our team. And then I think, for me, being able to do the genetic pop-up was really a great accomplishment for us, and we're looking forward to doing more of those throughout the state. I think in terms of the lessons learned, and I think this is a lesson we're still trying to learn, is how to make sure we have the right people on our team so that our state is represented, so that the professionals and the families and the people with genetic needs and diagnoses are all represented on our team. And so I think that's one of the lessons that we learned. Looking ahead, what is one change or improvement? I think one thing that was kind of a struggle for us was, and this is kind of a mixed bag, but so one of the out-of-state meetings we had was really good because it did give our team the opportunity to be together physically. But looking ahead, I think it would be helpful for our team at least to be able to meet in our state. Like some of the other states were really big. And so trying to get us all together in one place inside the state is almost as hard as trying to get us together outside of the state.
Didn't you even have one of those planned and it got canceled for weather?
Yes. Yeah.
Yeah.
Yeah. So our in-state meetings. Yeah. And so that's even tricky. So the traveling, I think sometimes that traveling for the face-to-face meetings, which with COVID, it's all different now anyway, but is a little bit more difficult for the people in our state. And so maybe doing that balance of in-state meetings and traveling out of state. And of course, with all the technology that we've got going on now, many of us are more skilled at that than we were before. So, and I don't know what the rest of my team would say because even my new co-lead is fairly new to our team. And so in terms of looking back and lessons we've learned, I think if you surveyed the whole team, you might get a different answer, but that would be my answers.
We appreciate your perspective, Jen. Thanks for sharing. Does anybody have any questions for Jen on any specific projects that they did, or I was gonna say some of them are still in process.
Well, and I probably should add, Chrissy, just because other teams might be interested, that what we did with our funding this year was to donate it, or not to do, I don't know what's the right word. We used our funding to help a project in Montana called the Montana Pediatric, it's called the MP2. But it's a project that they're working on that would be a cloud-based system to store medical information for people with disabilities. So when they go to the emergency room or need emergent care in other places, it can be accessed that way. And it's part of a HRSA grant competition. And so we helped, I think the money they're going to use is going to help to go towards parents to fill out the Montana Pediatric Project, to fill out the information in the app so that they can keep testing it some more. And so that's been a really great way to bring in lots of families from all across the state. That project had already done a good job bringing in families from across the state. But so that's, I think, something else that that we're proud of. I haven't seen how that's going to work yet, but that's something that is applicable to some of the other states.
Yeah, the MP2 project, if anybody wants to look it up, it's a really fascinating project. Thanks for sharing. All right.
Can you say that again?
Go ahead.
Is it M2 project?
M is in Mary, P is in Paul, the number 2.
Okay, 2 project. Okay, thanks.
And you can email me if you have more questions about that project and what they're doing. They are working with our USAID also with that project. So it's a very fantastic partnership with the state and the USAID and HRSA.
Okay.
All righty. Guys ready for the next one? I've got Wyoming. Did Carly or Amy make it? I know Carly had sent me a note saying she might be a little bit late. So Carly, are you on?
This is Amy. I'm not sure if Carly's on right now.
Do you want me to go to the next one and wait for her? Or would you like to present?
No, that's okay. I can present. I'm kind of in the same boat as Montana. I've only been a part of the team for about 10 months, but Carly and I speak weekly, and so I'm up to speed on what's been going on.
Great, go ahead.
For Wyoming, some big accomplishments is that our genetic clinic pilot is officially done. So that's really exciting. We're looking forward in this next 2-year cycle to move on to a new phase in our genetics clinics. We have stood up a genetics clinic in Riverton, which is in the same county as our tribal reservation. And so that's really exciting. We've gotten a lot of great feedback and a lot of support for that clinic. Some other cool things that we've done is Carly works really closely with the Colorado team, and we've been able to do some really great genetics counseling via telehealth through COVID that kind of just happened spur of the moment. And so those were actually very successful. Not something that either party usually does when we identify a kiddo as needing some genetics counseling. But so far it's worked really well. And also because of COVID, we're now putting in place some new protocols with our public health nursing offices to make sure that folks can still come to their clinics that are in person and feel safe and secure. So that's been really exciting to see that we're able to do that, and we're able to utilize our partnerships to make that happen so that folks can still be seen and not be left stranded or feeling like they can't talk to someone about their genetic conditions. So that's been really nice. Something that we're looking forward to in the future is we've been talking a lot, because a lesson learned from the pilot is that we have really great clinics who still refer to us, but then we have a lot of clinics who just don't. And so trying to figure out if family providers, pediatricians, et cetera, even know about our clinics and know about our capabilities. So in this next year or two, we're hoping to put out a provider survey, and we're looking to do it in conjunction with one of our partners, so that we can better understand the landscape, see what we need to do to provide more education and maybe some new media for both families and providers here in the state, so they know that these clinics exist. And then another thing we're looking into is we're trying to understand the landscape, especially right now with COVID, of how to better use our telehealth clinics, and how to do some better trainings for our public health nurses who are our key partners, so that we can keep our clinics going and really meet people where their needs are. So that's us in a nutshell, and we're excited to see where this next year leads.
Great, thank you for that overview. Does anybody have any questions for Amy? I just wanted to clarify, when you were saying about clinics referring to you, you were specifically referring to general family medicine or pediatric clinics. You have a group that's our strong refers, and then others that you don't know if they know about you. Is that what you were referring to?
Yes.
Okay. Great, thank you. Thanks for sharing. Grab another one out of the cup here. I've got Nevada. Let's see, Yasmin and Hannah on?
Hi, yes, this is Yasmin with the Nevada team.
Hey, Yasmin.
Hi. And Hannah's on too, so we're both gonna present our accomplishments and lessons learned. So I'll go ahead and start with our accomplishments. So like many of the other people, I haven't been the team lead for very long. I've just been since January of this year. So I asked for feedback from our other team leads as well, who've kind of been involved since the beginning. So in terms of the greatest accomplishment, we had a few, so we didn't really just select just one. But the Nevada team hosted a genetics webinar series via Project Echo, and that was with various topics such as gene sequencing, basics of genetics, and newborn screening. And those webinars were attended by healthcare professionals around the state, and from what I understand, they were well attended. Another accomplishment we had was the 2 genetic pop-up events this past March. We had one in Southern Nevada and one in Northern Nevada. So those genetic pop-up events went very well. We're very happy to be able to be a part of that. And we also have been working on a resource card for genetic providers that we can send out to other providers in the state so they're aware of what genetic resources there are within our state. So we finalized that card, and we're going to be hopefully distributing it soon. We've got some interest from some groups such as the Physician Assistant Association, and I know we're reaching out to other places, so we're trying to get that information distributed. And the last thing we have worked on recently was a brochure for careers in public health genetics. And we're working with the National Coordinating Center. They're helping us review it and possibly distribute it. So our goal was to create information and resources for students who are interested in a career in public health genetics. And we hope to get that going with in conjunction with the Public Health Genetics Week, which I think is coming up next week. In terms of lessons learned, so we had planned to do an in-person genetics and careers event for university students here in the state. And that's kind of what all our planning was going towards. And then, of course, the COVID-19 happened, so we could not do that. So I guess our big lesson is to always have a backup plan. And as a team, we just brainstormed ideas on how we can achieve the same goal as the in-person event in a different way. So that's how we came up with the brochure. And I think Hannah will go ahead and do the looking ahead for us. Thank you.
Hi, can everybody hear me? Yes, okay, good.
Yes.
My laptop was acting up earlier. This is Hannah, and just like Yasmin, actually, I just started as a co-lead, I believe February of this year, right before COVID happened. So looking ahead, one thing that we agreed on as a team is implementing some strategies to improve engagement among all team members. We kind of, so since I'm new to the team, one thing that everybody's given feedback on, we kind of felt behind at the very beginning of our involvement. I guess apparently the project was started with Nevada 18 months after all the rest of the states started. So the team felt that, you know, we weren't quite sure on what the overall objective that we needed to do as a team for Nevada. So that's one thing that we would like to do is implement strategies on how we can engage involvement. And also one thing that I just thought of since everybody was speaking, Texas was mentioning it, and I believe it was Wyoming right before us, how to reach out to providers to let them know that we are available, we're here as a resource, and also to reach out to them so that we can give resource, just like our brochure and the information card. And one thing that the team has been doing, we kind of did it the old school way. We just Googled associations, reached out to them, sent out an email saying, here is something that we have available for you guys. Is it something you're interested in? And now that we've started that ball rolling, we have actually started a list of locations that we can now reach out to. We have mailing addresses, phone numbers, and emails, and then direct contacts within associations. That way, you know, whoever takes over the team the following year or the year after that, it is now a resource that we can share, and it's still being developed so that we can share our brochure and genetic information card. And I think that's it.
Great, thank you both for presenting. Is there any questions for our Nevada team? No one's full of questions today. All right, I'm just going to ask. Joyce is letting me know that my slides are flashing. Is that happening on everybody's screen? Anybody else having that happen?
No.
No.
Okay, Joyce, I think it's
No.
you.
I don't know what I did.
Sorry.
Oh dear.
Well, sorry. All right, I got the next one up here is New Mexico. Dale, you're up.
Sí.
Or I should say Toro.
Sí. Buenos dias a todos. Good day to everyone. There's, as far as our team's greatest accomplishment, I would say the most amazing thing is our team's diversity. We have a very strong team representative of many stakeholders. And I think most importantly, we have family members who have had to face the challenges of either themselves or one of their family members having a genetic disorder. So getting their perspective is very important. Secondly, we've had incredible tribal American Indian representation. And then we have representatives from our Department of Health, newborn screening. We have pediatricians and actually even nutritionists. And we've been, I think, one of our greatest accomplishments with the support of the entire network is building a real strong team. Related to that, just a couple other, I think, accomplishments that have occurred. We've been able to use the end of year funding, one for a Prader-Willi project, working with the Prader-Willi Society, and looking at ways we can provide more knowledge and information for families with and patients with Prader-Willi. And then most recently, because of the incredible needs of the Navajo Nation, particularly related to COVID-19, we've been able to explore opportunities to use this, not a lot, but a small amount of the remaining funds to support the efforts of the Navajo Nation with respect to patients and families who need services there, where it is extremely difficult to get those services. So those, I think, are the three most important accomplishments, the greatest being the diversity of our team. What's the lesson learned? Well, one lesson learned was because of our team, we realized the unique perspective of our tribal partners with respect to genetics. We found that actually using the term genetics and saying, oh, you or your child or your patients have a genetic disorder is a turnoff. And in fact, it's better to say you, your child, or your patients have a condition. They're living with a condition that may have, and we don't, we know has an underlying genetic reason. But living with a condition is much more acceptable than saying, well, you have a genetic disorder. And there's some unique cultural perspectives with respect to how you look at genetics and how they look at life in general. So that's a really important lesson learned. I think we take those things for granted about the unique cultural perspectives. Now looking ahead, one of the things in New Mexico, we realize we need a strong network of originating sites. I think some of you have already alluded to that. But where can patients go to get genetic services around our state? We're the 5th largest state in the country. We're very rural. So we've been working with the Department of Health and our public health clinics. There's about 50 of them all over the state, of using them as originating sites. And they've been very supportive in that regard. So that's been an important aspect for us. You can have all these great services and you can believe in telemedicine, telegenetics, but unless you can connect to people, it doesn't do any good. And of course, we'd like to get into the home as much as we can, but we'll face those challenges, as I mentioned before, with connectivity, but we're working on that. And then secondly, looking forward, I would really like to see us all collaborate in the Mountain States region and even beyond, creating what I call virtual collaborative centers of excellence in genetics. Because some states have more resources. In New Mexico, we just, our only pediatric geneticist retired. And the other one is on leave, it's half-time. And so the more we can share resources in providing services for patients in our region, the better. And I would like us to look at that more seriously, that we collaborate, sharing knowledge, but also even sharing services, particularly with those states that may not have all the resources that they'd like to have, and other states that may have more. One good news looking forward is the university has hired a new pediatric geneticist, Dr. Marble, coming from New Orleans. He's actually been in quarantine because he came from New Orleans. But we do 36 outreach clinics. Incredible burden for just 1 or 2 people. So we see telegenetics as being a way of relieving some of that burden and complementing what we do in person. So, those are the major things looking ahead. I'm so happy to hear that we've been funded again, so we can really build on these ideas. And thank you to everybody that's been involved in supporting this project that's just being completed, but also the future opportunities. Thank you.
Thanks, Dale. Does anybody have any questions for Dale? And we should recognize Trish was his wonderful co-lead up until just a few months ago when she decided she wanted to retire full-time from the team.
Right.
She's still on the team, I should say.
Yeah, she's still on the team, and I forgot to mention that Trish has been amazing. She was the original lead. I came on as an afterthought. But Trish has been amazing with Family Voices and all her connections to the tribes and her understanding of family needs. She has been amazing. And I hope that we can recognize her for her efforts. She still will stay involved. And we'll be looking more seriously at a co-lead. And that'll be something we'll hopefully accomplish very shortly.
I like your statement about condition versus disorder. I second that as a mom.
Hi, buddy.
Yeah, right, exactly. And because there's sort of no matter what, either as a family or if even a cultural perspective, but it sort of creates a sort of a stigma. And I think that that this is a condition. We all have conditions, right? They may or may not have a genetic predisposition, although I would argue that genetics weaves itself through all types of medical problems and our predisposition to certain diseases. So yeah, I would agree with you, Heidi. It's an important concept. And I think that's what we can all share with each other as we learn more and more as we go forward.
One of the first books that I came across when my daughter was going through workup and things was Living Well With, and then the disorder name. And I think that really stuck with me because it was a book focused on how to live well with XYZ condition.
And, you know, I'd like to say one more thing because Liza's on the call with her beautiful child. Is that the fact that that this group has been able to actually provide data, how it's being used, and hopefully even look at the impact that it can have becomes really important if we're going to sustain these efforts, even beyond grant cycles. So, so I think being a team as part of the Mountain States network becomes really important.
We're very proud of having Liza in our network. Thank you, Liza, for all you do with the data.
And, you know, and everyone, I mean, we can do kudos with everybody, but Christy, who's our sort of our Facebook, social media guru, make sure that people are aware of what we're doing. I like the idea that was brought up about talking to our primary care provider groups about the services that could be offered through our network and also through our state. So that's something I want to pursue. We have a New Mexico Pediatric Society. It's a chapter for the American Academy of Pediatrics. I was just thinking, man, well, I need to make sure they're aware of what we're trying to accomplish. So, great idea, another great idea.
Lots of good ideas. All right, our next team up, Arizona, Fran and Kathy. You guys
hey there. Yeah. All right. So our greatest accomplishments, I think one of our top ones that Kathy and I talked about was having our Part C provider join our team. So our early intervention program in Arizona, we brought them on, the Part C administrator, and then Ashley, who was also in the administrative office, joined the team. And just having that perspective, they touch the lives of so many of these kids with genetic conditions that they've been able to start looking at their policies, and they've included information on Mountain States on their website. They partner, you know, with newborn screening program on quite a few projects that have been impactful, and I think it really speaks to the collaboration and the team approach, which is sort of one of our lessons learned. It ties in really well, communication and that whole teamwork. Rather than have one strong person who carries the burden, which I think in the past we had, somebody was passionate and did a wonderful job, but also carried all that burden sort of and responsibility on herself, versus truly collaborating with the team, where the best example is that the meeting in New Mexico where Kathy and I were delayed. We ended up flying from Arizona to San Jose to New Mexico, but because we had worked so well as a team, Ashley was able to pick up and sort of present our state team information that Kathy and I had intended. And to me, and I think Kathy probably would reflect the same sentiment, is that's what teamwork is all about, is you're aware of what's happening, you're not sort of siloing the work and carrying all the burden yourself. You really truly collaborate. So I think that's a really big accomplishment. Another one would be the Arizona Developmental Delay, the screening algorithm for pediatricians. We presented it at the Peds in the Red Rocks conference, which is our AAP annual conference, and we had, Kathy had these like bracelets that were also USB drives, and we had preloaded all of the Mountain States information as well as the Arizona specific algorithm on that, and those were given to every pediatrician that was there. So we were able to sort of spread our message and our work that way. Another thing was we had a geneticist join the team. Now we've had sort of interest in the past, especially when it was focused on newborn screening from some geneticists, but never truly wanting to enmesh in the teamwork. And so when Dr. James joined us on the team, he really participated. He came to some of the state meetings and helped us with developing that algorithm. He also attended our Latino Learning Community event and our genetic pop-up related to children with hearing loss or hearing conditions. So that was really nice to have his participation and input. Looking back, I think lessons learned, like I already stated, the communication and commitment, making sure we have involved team members, and that letting people who are less than engaged know that it's okay to you know, back out and or have somebody else participate in their stead. I feel like in the past, our team has some members that just have low participation, and so looking ahead, we need to figure out ways to engage the members of the state team a little better. So I think we have some thinking to do on how to do that. And then transition planning, and I've heard from so many of the other states who've already spoken today that there's a lot of new people, and making sure that you have some sort of succession planning in place so that when somebody with a lot of knowledge, historical knowledge, and you know, has been valuable members of the team, can pass that information on to the next person joining. So succession planning, I think, is a really important thing to think about. And then looking ahead, I think Kathy and I had talked about just surveying the Mountain States website to see how much traction is it getting. Are we pointing people in the right direction? Is it having the intended impact? Being able to look at some of that data to see maybe where else we can focus. I think another thing that we had put down for our suggestions when y'all were writing the grant was we were thinking of focusing on one thing. I hear that from other states. They sort of pick a condition that's of interest or needing support, and really focusing their efforts on that. And we had talked a little about maybe focusing on sickle cell. In Arizona, it's a very underserved population. Awareness, support, those kinds of things are really needed in our state. So looking ahead, I think we're thinking about making a focus on that as a condition. Kathy, can you think of anything I missed?
Can you hear me?
Yep, we can hear you.
Okay, good. No, I don't think you missed anything. When Fran mentioned about focusing on sickle cell, one of the things I wanted to bring up in today's meeting was, and talking about telehealth, are other states involved in surveying their community regarding telehealth and whether our families are able to get you know, the services they need through telehealth? I'm working on a project for sickle cell right now, asking our families, are they aware of telehealth? Do they have access, you know, and what are the results? And so I'm wondering if other states are going to do that with other conditions besides sickle cell, you know, or if you thought about it. But if we're going to go down the road of really trying to promote telehealth, which I think we should, you know, I think we need to establish a baseline of, you know, what are some of the issues our families are facing, and then move forward on trying to help with improving those issues or removing those barriers.
Yeah, Kathy, this is Dale. I think I've already mentioned, because of some interest of one of our team members, we collaborated with the Prader-Willi Society, and looked at how we're going to use telemedicine to get more services, and they're particularly interested in more information, also even having sort of more interaction with other families who are facing the same challenges around Prader-Willi. So some very specific things like that, help us move forward. And I'm sure there are a lot of other conditions which we could focus on and actually learn from others, that are focused on certain groups. But a part of what we did with Prader-Willi was a survey, not only of families, but also of pediatricians and primary care providers who have patients with Prader-Willi in their practice. So to see what they need and what they wanted. So that survey is still being analyzed, but is one of the things that we're doing.
Okay, good. Yeah, the other thing, because, and many of you don't know that, I have a sister who needs a liver and kidney transplant. And so we're in the pre-transplant phase. And one of the things I found out this week is that there's a policy within the practice of the transplant center that if you have a MELD score of 20 or above, then you have to be seen in person as opposed to telehealth. Well, we didn't know that, but, it makes me think about that going forward as part of telehealth. Is there a policy, and are parents aware that what is it that will say you get to be seen telehealth-wise as opposed to in person, those kind of things. So. Anyway, thank you.
Is that included, Dale, just what Kathy was asking about, in any of the things that you're doing at the NCC level? She was referring to certain policies of a certain score, or maybe a certain condition where it will give recommendations whether a person should be seen in person or via telehealth.
Well, it's certainly alluded to. I don't know if it has that level of specificity. I'll bring it up with David and the group, but particularly with COVID-19, it's the last thing you want to do is to bring somebody that's vulnerable, that needs a liver or kidney transplant, whatever, into an environment where they might get exposed to COVID-19. So a lot of pre-screening and follow-up with patients can be done before the actual procedure gets scheduled. So it's certainly a legitimate way of using the technology. Plus, just, if somebody is not feeling well, traveling to go to the center for something that could be done virtually, that it just makes more sense to use these tools.
Great, thank you. Thanks, Arizona, Fran and Kathy, for presenting. Does anybody have any questions for them before we go on to our last state?
I do. I was wondering about your USB bracelets. How many did you have, and how much did it cost?
Can you hear me?
Yes.
Mm-hmm. I think we paid like $500, and we got trying to remember, I'd have to go back and look if it was 250 of them that we got.
Okay.
But yeah, we kind of saved them for more special occasions as opposed to being at, event and just passing them out randomly. They're more targeted for who people we think would use them. Yeah.
Okay. And who loaded them all?
Our assistant did. Yeah. We have a flash drive, one of those ones that you can load, 25 flash drives at one time. It's a wonderful machine, let me tell you.
Maybe we need to invest in one of those if we're going to be doing that.
Maybe so. I did have a quick thing that I forgot to mention earlier. Those of you who have a university member on your team, one of our team members says interns are great for doing things like that, loading, doing flyers, brochures, translations, all kinds of things. So reach out to other university departments. and make it, make them all work with you.
Good tip. Good tip. All right, last but not least is Colorado. And I know Erica was going to be late to the call. Did you make it on, Erica?
I am here, and I know Tracy's here. I could not find my cowgirl hat. I apologize.
That's all right. Tracy found one for you.
I know. I just
costume here. I don't know if I can get it on you.
Oh, I just scrolled through to see you, Tracy. So,
all right, Colorado, you're up.
So, Tracy, do you want me to present, or do you want to present?
Oh, it doesn't matter. You want me to do number 1 and then you do 2 and 3?
That sounds fabulous. See what teamwork?
Okay.
Colorado.
So number 1 was our team's greatest accomplishments, and we kind of had 2. The pop-ups were pre-COVID, went really well, and in particular, the pop-ups to the Hispanic community were really well attended. Maria and Jesus, who are two of our team members, were able to link up with another group that was already having a convention and put a pop-up within their gathering. And it was, I think they had 25 people in attendance, and it went really well, and it really kind of just got them in the door to that community. So that they've asked them to come back and present different things and in future. So I think that was probably our biggest accomplishment from the pop-up part. And then now it's just going to be creative because, you know, people don't want to come out with the whole COVID thing. So we're going to have to get a little bit more creative on how they deliver them. But that was definitely a big success of this year.
Well, and Tracy, if I can interrupt and add to that, you guys haven't had your state team meeting because it's this afternoon yet, but Jamie's pop-up went virtual. And so she was the first virtual pop-up to happen in Colorado too. And she had 97 registered.
Oh, wow.
So,
that's amazing.
Super. So it shows you can do it virtually as well and in person.
Yeah, so I think that's been great, and it's really been a way for the kind of families affected to reach out to other families who are affected, and that's kind of making that bridge between provider and family and pointing them to the right resources and stuff like that. So I think that's been really good. And then the other accomplishment we had was our virtual ed series, which took a little bit of, we had some work through, that'll be number 2 to get it up and going, but we were able to collaborate a little bit with the Children's Hospital of Colorado's education series, and they got Erica a slot, like a regular slot each month, and so I think that was a really good addition to the state team. So you want to go with number 2 and 3?
So lessons learned is really just being more creative with getting more participants, and that includes both of our pop-ups as well as our virtual education series. So we have learned with pop-ups that we definitely can increase the number of attendees when we piggyback it on a pre-existing meeting, a pre-existing group. The one that we tried to launch that was truly just from a grassroots effort and get some of our families from Children's Hospital to join in on. We selected and reached out to families with children of inborn errors of metabolism, and it was a little bit too much of a narrow group looking back on it. And with that being said, it was on a Saturday. It was not associated with any other type of event. It happened to probably be the first weekend that COVID was in the news, which maybe most families did not have on their radar yet, but families of children with healthcare needs definitely had been hearing about it. And so unfortunately, we did not have a lot of attendees. That was a consumer that is local here and hoping to get more involved. And she took that experience and really expressed that it would probably work out better if, again, we could have that group already planning to meet and bring the pop-up to that group in the case like Jose and Maria have done, and really just ensure that they have a captive audience already, especially when doing a pop-up from the ground up. That also includes our virtual education series of getting more providers linked on. We currently are pausing with COVID. one of our team members who's a PCP in the community really expressed that PCP offices are just trying to just stay afloat right now. So maybe April and May, we took a pause with trying to schedule genetic education because that is not their priority right now. But really trying to figure out a way to get additional PCP offices involved. Through our children's hospital, we do some significant marketing, and also one of our team members took it upon himself to do some marketing to the Colorado AAP. With that being said, we still get relatively low attendance from PCPs. So ideas have included expanding that to maybe including mid-level providers, family practice providers, and really just getting it out there outside the PEDS bubble to get the participation increase. We feel like once they come, they tend to come back again. That'll be something we can think of for next grant cycle. So moving on to number 3, when we look ahead, I think one of the things, and this is especially as Fran's talking about some of the connections they've made in Arizona, for us is to really expand and work a little bit more closely with our public health department and maybe having additional, who's the angry driver on there? Everybody okay and safe? So with that said, maybe getting involved and getting some representation from either early intervention at the public health level, HCP nurses. We might find better ways to get our genetic resources and our educational materials out to the rural communities if we can improve on that connection moving forward. Tracy, is there anything you'd like to add for looking ahead?
No. I'll fill you in on 2 of the, I want more information on Montana's project. So Christy, I sent you an email to get that link. But no, I can't think of anything else other than to get COVID creative.
And Erica, I was just going to add, I just got a email from the consumer that you referred to with the grassroots pop-up. Yeah. And she has a Zoom call scheduled for June with the early childhood intervention providers. So she decided to take the lemons she felt from that experience and make lemonade, because she comes from that environment as a service coordinator, and she really thought she didn't want these resources to go to waste. So she's taking those resources in a virtual meeting to service coordinators for early childhood intervention.
And getting to know some recent friends and colleagues that are in that early intervention group, they truly are in the homes of these infants that maybe nobody has really brought up that there could be a genetic diagnosis, or that there's more than just this delay of feeding or this delay of their milestones, and really are on the ground in the homes providing those therapies. And really it's something we hadn't thought to include until our consumer kind of, we have Jamie on our team, and she's in the EI group too, and she also is kind of connecting that gap, but then having a pop-up to really address that is really a great way to take that lemon.
Yes, and make lemonade. Awesome. Does anybody have any questions for Erica and Tracy? No questions. All right. Well, we have we asked for everybody if you could stick on for an hour and a half, so we have about 15 minutes left. And if I can open it up just for any general questions for any state, now that everybody's heard from everybody, and then after that, Joyce and I have a little fun for y'all here at the end. Does anybody have any general questions to ask any state that's presented today, or any thoughts that have come up since you've listened to everybody?
No questions, but I just searched on my browser MP2 Montana, and I think I got the right information.
Awesome. You want to put it in the, you want to cut and paste it in the chat box?
Sure, I can do that.
I'm going to take a sip here. All right. You ready to go, Joyce?
You bet.
All right. We have state team awards for you all.
Oh boy. and I've got to give credit to Christy. She came up with the names, and all I did was laugh and enjoy them. And so we're going to share them with you now. And so the first one is Arizona. There. And Arizona gets the Pony Express Award. And that is because they were the first to expend their state team funds. So congratulations, Arizona.
Thank you.
Thank you.
Guys, we're speedy. All right, and the second team award goes to Colorado. Colorado State Team, you guys get the Genetic Ranger Award for excellence in genetic education presentations with your virtual education series, establishing Genetic Tuesdays, and even providing a genetic presentation in Spanish at El Grupo Vida. And how about the magnets? Can't forget about the magnets.
Oh, there's still a lot of magnets in my office, so.
Good thing they didn't change our name for the next grant cycle.
They didn't decide to do the network back to the collaborative, back to the network thing again. So
that's right. All right, next award. You ready, Joyce?
Yes. Okay. And this one is to Montana, and it's the High Stepping Helping Families Award. And that's for your gas card assistance. Excuse me, to get families to conferences around the state. And, excuse me, including funding for MP2.
Thank you.
Thank you, Jen. All right, and the next one is Nevada. We're giving Nevada the Golden Saddle Award for having the most co-leads in the leadership saddle of Nevada. And so we are so glad to have Hannah and Yasmin in that saddle right now. And we just thank you guys for your leadership and all the other co-leads that have come before you for their leadership as well. So thank you guys and gals. Are you guys still on?
Thank you, Christy.
Oh, you're welcome. All right, you ready, Joyce? Next one.
Yes.
New Mexico.
New Mexico. The Courteous Cowboy Cowgirl Award. And that's for helping family organizations, the Prader-Willi Association, the Navajo Family Voices, with their needs in accessing genetic care.
Thank you.
Dale still on? There he is. Okay.
Muchas gracias.
All right, and Texas, I joked about this on a state team call, but here it is. The Friendly Frugal Fiddle Award goes to Texas. And as Melissa, thank you for setting this one up, because you talked about all the free resources that the Texas team found. And literally every time they went to go spend their money on something, they found that it was free. And so that's why they get the Friendly Frugal Fiddle Award, because most of the things that they wanted to spend their money on ended up being free. So talk to them if you don't have any funds left and you want to find some free things to do. Congratulations, Melissa and Casey.
And our next one is for Utah. And it's the Developmental Delay Algorithm Deputy Award. And that's for the creation of the handbook for the specific algorithm and implementing it into practices in Utah. Thank you.
Congratulations, Heidi. I think Chuck had to leave. Are you still on, Heidi?
Yeah, I'm still on. Thank you.
You're welcome. All right, and last but not least is the Tenacious Tumbleweed Telegenetics Award goes to Wyoming State Team. Amy and Carly, if Carly got to make it on, and this is for excellence in equipping their state with telegenetic capabilities. So congratulations. Are you still on there, Amy? She might have had to run. And with that, we want to thank you all because you guys are truly the heart and soul of our region, and we could not do any of the work that we do without you all. And we want to send you all a heartfelt thank you for everything you all have done. And we're really looking forward to the next grant cycle. More details to come. We will be probably working on some new plans in June as we go back through our work plan and figure out what that looks like. And so stay tuned for that. Joyce, do you want to share our plans going forward here for the next month or so?
Well, we would suggest that we all take a break in June, and it's well earned, and we not have any state team calls for June. And we'll come back in July, and we will, as a management team for the new grant cycle, will have had a chance to talk and to come up with some of how we need to proceed and what the expectations will be from HRSA for us, and incorporate some of those suggestions, I hope all, that you have given us. They're excellent. And Christy and I had talked about some of them from our perspective, and have written into the grant to have more communication between the state teams. And you all are just terrific. And thank you from the management team and from HRSA too. They've recognized the value of the state team structure, and because we're the only region with that. Everyone else has committees or a task force or a working group, whatever. But we love this. Every state in our region is involved and just doing really creative and important kinds of projects. So a big thank you to everyone.
Tip our hats to you all.
You bet.
And back at you, management team.
I'm having
Thank
a
you.
wardrobe malfunction. Thank you all. Does anybody else have any closing thoughts or comments? If not, we can wrap up a little early.
This is Fran. I'll say thank you to Christy and Joyce for your leadership.
Oh, thank you. You're welcome.
Keeping us all on track and our monthly calls. Thank you so much.
Thank you,
I
guys.
second
I've
that.
enjoyed hearing from all the states what they're doing. So that was nice. Thank you.
Hear, hear.
So while you all are on, can we ask you, would you like this repeated in the new cycle? Would you like this type of format with the co-leads sharing repeated, maybe quarterly, which was Melissa's and the Texas team's suggestion? Would that be too burdensome, or would that be just right?
I'd say either twice a year or quarterly.
Yeah.
I would hope one day that we get to have a face-to-face state lead meeting, because I have to say the few times we've had that opportunity, it's just been a wonderful 24 hours. So maybe we could have some virtual meetings to hear updates, but it would be really nice for at least once a year to have some reserved time for just the state work.
For sure. And the genetic summit was still written in the grant application, so that's not gone by the wayside. We're having initial talks that probably will not occur in the fall and might be next spring. So stay tuned. We don't have anything definitive yet, but stay tuned for that.
Mm-hmm.
I think twice a year would be great for updates, but I think our next quarterly one, it would be nice if there was like a breakout session. One of the you know, what one of the teams is doing, that could help the rest of us. And I'm trying to think of which one I was interested in. I wrote myself a note. I can't find it right quick, but, you know, I think it was Texas, getting out to physician's assistants. And I mentioned that earlier. So could there be like a breakout session on something like that?
Mm-hmm.
Just to help the rest of us who are interested.
Or even maybe as you talk about that, I'm thinking of like maybe there's a quarterly topic for those to join who are interested in that topic. And so it's not a, you know, required, not that any of these are required, but you know what I mean? It's not an all team meeting, but only for those that are maybe interested in that topic.
Right. Yeah.
Okay. Well, thanks for your feedback all.
All right,
Have a great
thank
rest of the
you.
week.
Thank you all.
Thanks for the hat, Christy.
You're welcome, Joyce.
Bye.
Bye, everyone. Stay
Bye.
safe.
Bye-bye.
Bye-bye.
Bye.
Bye-bye.
Bye.